what is adrenal fatigue and what is the best way to combat it? I know we have talked about it before on the channel, but what is your personal take on it?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Being a dermatologist, I recommend Mizumi skincare products for all acne-prone skin. Link in the description of this video.
Yeah, adrenal fatigue. That one is tough. And I tell you, we could spend a lot of time on this because, we're talking about an issue that isn't even well defined. In conventional Western medicine, the endocrinologists believe there's Addison's disease, which is too little cortisol, and there's Cushing's disease, which is too much. Got the extremes. And that's what the conventional Western medicine agrees are the two real issues you deal with, too much or too little. But the vast majority of people, 80% by my research, and the other 20% are liars in my opinion, but at least 80% of people suffer somewhat from adrenal fatigue. Now, adrenal fatigue is also known as adrenal insufficiency, neurasthenia, or hypoadrenia. So it's not difficult to comprehend. Obviously, you can't attribute a word like fatigue to a gland. You think of fatigue as something that we experience as we're just getting tired. But one of my mentors, Dr. Edwin Lee, MD, endocrinologist, who's very, very young, very forward-thinking. He's always attending our conferences, giving us talks at the A4Ms or the AMMGs. He's written a book called Feel Good, Look Younger. Feel Good, Look Younger. Great, great paperback that's got a great chapter on adrenal fatigue, how he defines it, how he manages it. But let me tell you something, how I deal with it as a board-certified naturopathic physician. If you think of the adrenal glands, I want you to think about salt, sugar, and sex. Salt, sugar, sex. So let me expound on that. Salt, the adrenal glands deal with aldosterone. That balances your salt homeostasis. Sugar, adrenal glands produce cortisol. That will ramp up. If you get secretion of cortisol, it increases glucose into the bloodstream. That's your sugar. And then sex, it's a powerful, it produces, the adrenal glands produce DHEA, the neurosteroid. So you got the sugar, sex, and salt, meaning aldosterone, cortisol, and DHEA. Now, the adrenals also produce catecholamines. We're not getting that right now. So, we live in a highly stressful society. Years ago, at the turn of the century, last century, early 1900s through mid 1900s, the average American got over 9.5 hours sleep. Now, the average American gets less than 7. Some say 6.5 hours of sleep. So over the last century, we as a species are devolving in our sleep hygiene. So we're not recovering at night. Our adrenals aren't recovering at night due to good night sleeps. So that's one of the issues that is causing adrenal fatigue. The stress of work, traffic, relationships, finances, politics. It causes a lot of stress also. So again, a famous doctor once told me that in the old days, if you knew syphilis, you knew medicine. Now, if you know fatigue, you know medicine. The number one symptom of hypoadrenia is fatigue. And so you do a careful history. These people tell you that, Doc, I get, 7, 8 hours sleep every night, but I wake up feeling so tired. I just don't wake up feeling refreshed. I'm always tired. And then I don't feel, so I feel like I'm waking up till 10 o'clock in the morning. And then by lunchtime, I get a meal and I feel great, but I crash mid-afternoon, 2 to 4 in the afternoon, I'm crashing. And if I eat a meal at nighttime, I feel good. And I want to do some more work, but I can't go back to bed until 1 or 2 in the morning. So their clocks are all kinds of messed up. So they tell you that all the time. All right, that's a history you get. So one of the things I do, there are some naturopathic things we can do to look at a patient to help diagnose hypoadrenia. Remember, hypoadrenia, it's adrenal fatigue. If you are sitting down or laying down in particular, and then you stand up, the blood pressure tends to go up as a compensatory mechanism by about 10 to 20 millimeters of mercury. However, hypoadrenia patients, when they stand up, their blood pressure drops about 10 millimeters of mercury, and that's when they get a lot of orthostatic hypotension. It doesn't adjust itself. So they stand up, blood pressure drops, orthostatic hypotension, body doesn't adjust to that, doesn't adjust and bring the blood pressure back up, to perfuse the gourd. They crave salt a lot. They crave sugars. They crave carbohydrates. All right. They tell you that they drink a lot of coffees and teas through the course of the day to get through their day as a productive member of society. So I'll do that measurement, lay them down, get them up, look at the blood pressure and see if it's gone down and hasn't come up. There's a thing called Sargent's white line. If you take a blunt instrument, like the end of a tuning fork handle, and you scrape it across their tummy, you get a white line. And it usually lasts for about a minute or two, then it turns red. All right. People who have hypoadrenia, they don't get that redness. They don't get that redness, or it's protracted. It may take 10 or 15 minutes for that white line to turn red. That's called the Sargent's white line. You can also deeply palpate over the adrenals for tenderness, or deep pressure for tenderness. And that's called Zogoff's sign again. And lastly, there's a thing called estenochoria. Estenochoria. And that is, if you shine a bright light in that patient's eyeball, the eyeballs will constrict. And it will hold that constriction as long as you got that light in there. But if a person has got adrenal fatigue, their pupillary constriction can't hold. It constricts, it starts vacillating, and then opens. So it won't hold that the iris shutter closed. It tends to vacillate and open. And again, that's estenochoria. So, but again, are they commonly found across the board in all hypoadrenic patients? No. But if you get the history, you do those 4 things, and it starts leading towards your diagnosis of hypoadrenia, then you look at lab tests. So, and there's no real good assessment, of hypoadrenia, but here's what I do. The earliest indication that your adrenals are failing you and they're not recovering at night due to a good night's sleep is your DHEA. Your morning DHEA is going to be down significantly. Now, what's the range? A lot of you don't know what the normal range of DHEA is. I like it 300 to 550 in everybody, male and female, like it's gender neutral. But if your morning DHEA is under 100, your adrenals are not recovering at night. A little more sensitive test than DHEA is morning cortisol levels. All right. If your morning cortisol is above 20 or greater, you have healthy adrenal function. If it's under 10, you have a hypoadrenia. So morning cortisol is under 10, indicate to me with history and the physical signs that you have a hypoadrenia. If your morning cortisol is 3 or less than 3, I give you a consult to endocrinologist ASAP. All right. So you got the history, very important. You got the physical exam, helps you a lot, but that history, physical exam, and DHEA levels in the morning and morning cortisols help you dial in your diagnosis. So, and lastly, treatment. How do you treat it? Well, you got to address sleep hygiene. So if you get a good night's sleep, you can really, really help mitigate the severity of hypoadrenia. Salt, if it's mild hypoadrenia, I say pink salt to taste. Pink salt, Himalayan sea salt, Celtic sea salt, pink salt to taste. Vitamin C at 2 to 4 grams every day. All right, crucial. Vitamin C and magnesium. I also add a lot of vitamin E. So vitamin C, magnesium, and vitamin C are crucial because to make cortisol, you need to burn through a lot of vitamin C. You use a lot of vitamin C in the production of cortisol. All right. So that's how the lab tests I look, the history and the physical exam. Now, there are herbs. We all know there's adaptogens. They're the herbs, rhodiola, ashwagandha, eleutherio, licorice root that helps. These are herbs. Now, I have a lot of training in herbology, but the biggest issue I have with herbs in the marketplace is where are they coming from? Who's standardizing the doses? So Designs for Health was a company I work with. They have a great product called Adrenotone. It has the vitamin C and E and the rhodiola and ashwagandha and B6 and B12, all the different vitamins and minerals you need to help restore good health to the adrenals. And the reason I like it is because I know that what is in this product is pharmacy grade. So I tell my patients, you gotta go on some Adrenotone through Designs for Health for 2 to 4 months. Let's get your sleep hygiene improved. Get you to pink salt your food to taste, vitamin C, vitamin E, and of course the B vitamins I just mentioned. Very, very important. Now, in the rare cases that none of those things work, then I will revert to oral cortisone. Hydrocortisone.
Yeah.
I mean, in fact, I do it a lot. For some reason, I must have a lot of difficult patients that see me because nobody else will go that route. Cortisone has been around a long time. So, I mean, I start somebody at 10 milligrams of hydrocortisone in the morning, and then by lunchtime, 5, and by dinner time, 5 more. So usually 20 milligrams PO, which is still sub-physiological, because the body produces 30 to 40 mg of cortisone daily. So if I'm giving you 20 to 30 during the day, I'm not going to shut you down. I'm just giving you some help. And I do it for 2 to 4 months. While I'm working on nutrition and sleep and getting things come back online naturally, then I'll taper you off the hydrocortisone as your adrenals are now recovered. So it's true. It's around the vast majority of people around the world have some form of mild to severe adrenal fatigue. Just because we live in a highly stressful environment, we're not getting the amount of sleep at night, and because there's so much lights going on during nighttime, feeling like computers, and there's lights in the bedroom, we're not getting the melatonin production at night either, which impacts our sleep cycle, which is why we're sleep deprived, which is why we're suffer in toto as a population with some form of either mild to moderate to severe hypoadrenia.
Yeah.
Right.
Great explanation. Thank you, Jeffrey.
You're welcome.
And now give this video a thumbs up and go watch one of these videos to learn a ton more about TRT and hormone optimization.